about COVID-19. COVID-19 is a part of the coronavirus family, or can call as SARS-CoV-2 virus. The virus identified in December 2019 in Wuhan, China. It was declared by the World Health Organization in March 2020. The virus is believed to have originated in aquatic food such as snakes, birds, and mammals, but bats were the most host of this virus. COVID-19 became a global threat at the time because it can spread easily from person to person through talks, cough, and sneeze. The lack of immunity also can be at risk because of weak antibodies that can spread easily. It primarily affects the respiratory system and can cause a wide range of symptoms, from mild to severe. To prevent it, government implemented various of ways such as lockdown, social distancing, mask mandate, and vaccination.
Hi, I'm Farsha. Next, I'm gonna explain about routine and non-routine. COVID-19 cases are non-routines because they occur suddenly and unexpectedly. No complete preparation can be made to prevent the virus from spreading. Many places are used as quarantine center for those infected with the COVID-19 virus. For example, in this article, provisional hospitals were established, including the transformation of the Agro Explosion Park Serdang MIPS into a quarantine and treatment center for low-risk patients. An innovative response to challenge that has never been seen before, because many doctors and nurses are deployed and made frontliners. Also, Movement Control Order (MCO) with legal enforcement. Next, it became routine when it included health screening at entry points, where thermal scanners were deployed to detect fever among travelers, along with isolation and quarantine measures for those returning from high-risk areas. Public awareness campaigns were also routine action, with daily press briefing, infographic, and social media initiatives such as #StayAtHome used to promote preventive measures. The production of personal protective equipment (PPE) by NGOs, volunteers, and prison inmates addressed shortage for frontliner, while regular disinfection activities were carried out in high-risk areas by local authorities. Now I will explain to you about basic element of the problem. First, origin and spread. It's happened because of the human resources. As linked with the article, the virus primarily transmits through respiratory droplets and contaminated surfaces, with symptoms ranging from mild fever, cough, and fatigue to severe respiratory distress and organ failure. In Malaysia, the outbreak involved through 3 distinct waves marked by significant clusters, including one linked to religious gathering and others involving imported cases. Next, Malaysian response connects with the present state in Chapter 5. To make it clear, the Malaysian government implemented stringent measures, including the Movement Control Order (MCO), health screening at entry points, quarantine protocols, and the establishment of dedicated COVID-19 hospitals. The third one is economic impact, which link with the uncontrollable factors by basic element of the problem. This is because the pandemic's economic and social impact were profound, severely affecting industries such as tourism and small businesses, prompting the government to introduce financial stimulus package like Prihatin to support affected sector and individuals. Next basic element of the problem is public support, which link with the desired state. It described in the statement of objectives, goal, or expected outcome towards. To elaborate more detail, public awareness campaign led by media aided in mitigating the virus spread. The last basic element of the problem is global response, which connected with time and basic element of the problem in Chapter 5. For example, globally, COVID-19 affected over 213 countries, overwhelming healthcare system, disrupting economies, and necessitating unprecedented international cooperation to combat its effects.
So, COVID-19 is a highly dangerous disease in the year 2020. It includes several problems related to COVID-19 mentioned in this article, such as cluster formations and a few more. First is cluster formation, which is the main issues in this article. Cluster formation occurs due to large gathering, which lead to the spread of the virus and increase in cases. This happened at Sri Petali Mosque as a result of hosting a religious gathering. The gathering contribute to the rapid spread of the virus. Second is healthcare system strain. This is another causes due to the lack of PPE for the hospital worker. Because of the burden on hospital is increasing, they require support from retained medical professional. PPE is crucial to prevent the spread of the virus. In addition, economic impact. This is because during the COVID-19 pandemic, the country's economies were severely affected. For example, the tourism sector suffered because people were unable to travel due to the lockdown. This economic impact also affected the government, particularly with the pre-hatting package worth 250 billion, causing the Malaysian government to incur significant losses. Lastly, communication and public awareness. This is because Malaysians did not take the spreading COVID-19 seriously. As a result, the government disseminates information about the COVID-19 across all platforms, including televisions, to raise public awareness about the dangers of the virus. Among the solutions are health system enhancement, movement control order (MCO), public awareness campaign, and community and NGO involvement. So the first problem-solving measure is the health system campaign. It's helped to reduce the spread of COVID-19, such as conducting self-check before entering public places, temperature scanning, and using messenger apps. It is crucial to monitor our health status and prevent COVID-19. Additionally, isolating oneself from others who have contracting COVID-19 is an effective way to stop the virus from spreading further. Next is Movement Control Order (MCO). The government implemented the MCO to break the chains of COVID-19 transmission. This was supported by strict law and campaign promoting 1 meter physical distancing in public places to prevent the spread of the virus. In addition, public awareness campaign. This is because such as campaign can make Malaysians aware to the COVID-19 is extremely dangerous and can be fatal. Therefore, the government launched campaigns such as #StayAtHome to encourage health preservations and social distancing. This campaign were also carried out by disseminating information on the televisions about COVID-19 developments and promoting like #StayAtHome on social media to raise public awareness. Lastly, community and NGO involvement. It can help to reduce the spread of COVID-19. For example, communities and NGO have been involved in providing food to those in need and supplying PPE for frontliner workers. They also produce hand sanitizer and face shield sewn by prison inmates to help control the virus from continuing to spread.
Next, I will explain the 8 problem solving in this article. The first step is to recognize the problem. Based on this article, cluster information that is the main issues from this article. The second step is to define the problem, which occurs because of the gathering of people in the same place. This is because gathering in the same location will facilitate the spread of COVID-19. After that, the third step is to collect relevant information. The problem that occurred was caused by cluster information throughout the area. It happened at the Sri Petali Mosque in the year 2020, where a religious event was taking place at that time. This contagion became increasingly widespread because the individuals who attend the event gathered in the same location in a crowd. This caused the people who attend the event to be infected with COVID-19 because there was no quarantine at that time. Therefore, because too many people were infected at that time, the organizer who organized the event were responsible for resolving this matter. The first step is to analyze the relevant information. As stated in this article, there is no quarantine that causes the transmission of COVID-19. Then, the fifth step is to develop an alternative solution where the government implements a very strict movement control order (MCO) at that time. During this outbreak, only the head of the household can go out to buy household items at that time. Next, once outside, you must wear a face mask and always use hand sanitizer. And only one person can be in a vehicle. Anyone who disobeys this order will be subject to fines and disciplinary action. This means that the spread of the disease can be reduced. Step 6 is to choose the best solution to reduce cases from continuing to increase. By carrying out activities online is an initiative to overcome this matter. Next, the Malaysian Ministry of Health is always controlling this virus from continuing to spread by providing vaccines to the country's frontline because they need to be on duty at that time. The seventh step is to implement a solution where the entire state is enforced with strict support and legal regulation, such as not being able to cross the borders of other districts and states. Only individuals who need to work at the state border are allowed to cross along with evidence from the company and the police. Next, individuals must maintain 1 meter between other individuals. Finally, the last step is to evaluate the results. As we can see now, the spread is decreasing because we have succeeded in overcoming this issue since it is very effective and easy to follow.
Alright, to conclude this presentation, the COVID-19 pandemic has had a profound effect on the people of Malaysia and made our country's economy collapse and the death of many people. So first is MCO control cluster. So the government came out with a solution which implemented a movement control order, which is MCO, that can control the clusters. This could prevent the citizens from going out and taking care of themselves and just stay at home. And not just that, the government also developed an app called My Sejahtera to keep track of who is infected, and it is really efficient to use because it can track our symptoms and we can take early precautions. And then community efforts aid containment, which is citizens also feel grateful because of there are many communities that help out to give food and other necessities to the one who needs it. And then recovery strategies address economic challenges, which is the government giving financial aid to citizens such as prihatin to support affected sectors and individuals. This could help to reduce their burden and live a better life. As mentioned in the article report, which affects performance, said that the government provided RM250 billion to support the low incomes and businesses that were affected by the epidemic. Alright, so moving forward, ongoing research support resilience. So here are some actionable recommendations for improvement for future. So the government can do a continuous research in this kind of epidemic so that they can understand the effects of the infection in human body and effects from the vaccination that people had in their body, because of certain people said that the vaccination actually give a big negative impact in their health matters. And then for the person who thinks that they cannot handle their emotion regarding these issues, the government can promote support for one's mental health to detect psychological impact on them and communities. So that is the end of the presentation. Thank you.